All attendees are in listen-only mode.
Hello and welcome to this presentation on aging and osteoporosis. My name is Lori Benison and I'm a wellness coach for Lovelace Health Plan. Before we get started, I'd like to go over a few housekeeping rules. Know that everybody's in listen-only mode. If you have any questions, you can jot them down and email us at healthysteps@lovelace.com. Some of you may notice a delay in the slides or scratchiness or static on the line. If for some reason you get disconnected, don't panic, just call back in. Know that this presentation will last approximately 30 minutes, and after the webinar, we'll send you an evaluation. Your feedback is important to us, so please take time to complete. It helps us to help you. So today, we're going to talk about what osteoporosis is and osteopenia. We'll talk about changes in posture and gait or walking pattern. They're usually are universally associated with aging as changes in the skin and hair. And today we'll be talking about how aging can affect bone density and what you can do to prevent problems with muscles, joints, and bones. First, I want to tell you a story. Helen grew up on a farm in the Midwest. She drank lots of milk as a child. She also walked a lot. After graduating from high school, she got married and found a job. Family and work, she said, kept her too busy to exercise. Helen went through menopause at age 47, and at age 76 she was enjoying retirement, traveling and working in her garden, but then she slipped on a small rug in her kitchen and broke her hip. After Helen recovered, she needed a cane to walk, and gardening was much harder to enjoy. Helen has osteoporosis, but she didn't know it before she fell. Osteoporosis is a disease that weakens bones to the point where they break easily, most often bones in the hip, backbone, and wrist. Osteoporosis is called the silent disease because you may not notice any change until a bone breaks. All the while, though, your bones have been losing strength for many years. Bone is a living tissue. To keep your bones strong, your body breaks down old bones and replaces it with new bone tissue. As people enter their 40s and 50s, more bone may be broken down than is replaced. A close look at the inside of bone shows something like a honeycomb. When you have osteoporosis, the spaces in the honeycomb grow larger, and the bone that forms the honeycomb gets smaller. The outer shell of your bones also gets thinner. All of this makes your bones weaker. Bone mineral density is a measurement of the level of minerals in the bones, which shows how dense or strong they are. If your bone mineral density is low compared to normal peak bone mineral density, you are said to have osteopenia. Having osteopenia means that there's a greater risk that as time passes, you may develop bone mineral density that is very low compared to normal, and that's known as osteoporosis. Osteoporosis is a condition characterized by progressive loss of bone density, thinning of bone tissue, and increased vulnerability to fractures. For some people, the first sign of osteoporosis is to realize they are getting shorter or to break a bone easily, like Helen did. Don't wait until this happens to see if you have osteoporosis. You can have a bone density test to find out how strong your bones are. Your doctor may suggest a type of bone density test called a DEXA test if you're a woman age 65 or older, or if he thinks that you're at high risk for osteoporosis. The DEXA test gives you important information to help you understand your risk for a fracture or broken bone. It could show you that you have normal bone density, or it could show you that you have low bone mass and even osteoporosis. 10 million Americans have osteoporosis. They're mostly women, but men also have this disease. White and Asian women are most likely to have osteoporosis. Other women at greater risk include those who have a family history of broken bones or osteoporosis, who have had a broken bone while they were an adult, had surgery to remove their ovaries before their period stopped, or if they experienced early menopause, have not gotten enough calcium throughout their lives, or have had extended bed rest, or used certain medications for a long time. Having a small body frame might put you at risk, and of course the risk of osteoporosis grows as you get older. At the time of menopause, women may lose bone quickly for several years, and after that, loss slows down but continues. In men, the loss of bone mass is slower, but by age 65 or 70, men and women are losing bone at the same rate. The skeleton provides support and structure to the body. Joints are the areas where bones come together. They allow the skeleton to be flexible for movement. In a joint, bones do not directly contact each other. Instead, they're cushioned by a cartilage in the joint, synovial membranes around the joint, and fluid. Muscles provide the force and strength to move the body. Coordination is directed by the brain, but is affected by changes in the muscles and joints. Changes in the muscles, joints, and bones affect the posture and gait and lead to weakness and slowed movements. Bone mass or density is lost as people age, especially in women after menopause. The bones lose calcium and other minerals. The spine is made up of bones called vertebrae. Between each bone is a gel-like cushion or intervertebral disc. The trunk becomes shorter as the disc gradually loses fluid and become thinner. In addition, vertebrae lose some of their mineral content, making each bone thinner. The spinal column becomes curved and compressed, packed together. Bone spurs caused by aging and overall use of the spine may also form on the vertebrae. The foot arches become less pronounced, contributing to a slight loss of height. The long bones of the arms and legs, although more brittle because of mineral loss, don't really change in length. This makes the arms and legs look longer when compared with the shortened trunk. The joints become stiffer and less flexible. Fluid in the joints may decrease, and the cartilage may begin to rub together and erode. Minerals may deposit in and around some joints, called calcification. This is common in the shoulder. Hip and knee joints may begin to lose joint cartilage due to degenerative changes, and finger joints lose cartilage and the bones thicken slightly. Finger joint changes are more common in women and may be hereditary. Some joints, such as the ankle, typically change very little with aging. Lean body mass decreases, caused in part by loss of muscle tissues or atrophy. The rate and extent of muscle change seems to be genetically determined. Muscle changes often begin in the 20s in men and the 40s in women. So bones become more brittle and may break more easily. Overall height decreases mainly because of shortening of the strength in the spine. Inflammation, pain, stiffness, and deformity may result from breakdown of joint structures. Almost all elderly people are affected by joint changes, ranging from minor stiffness to severe arthritis. The posture may become more stooped or bent, and the knees and hips more flexed. The neck may become tilted, and the shoulders may narrow, while the pelvis becomes wider. Movement slows and may become limited. The walking pattern or gait becomes slower and shorter. Walking may become unsteady and there is less arm swinging. Older people become tired more easily and have less energy. Strength and endurance change. Loss of muscle mass reduces strength. However, endurance may be enhanced somewhat by changes in the muscle fibers. Aging athletes with healthy hearts and lungs may find that performance improves in events that requires endurance and decreases in events that require short bursts of high-speed performance. Osteoporosis is a common problem, especially for older women. Bones break more easily, and compression fractures of the vertebrae can cause pain and reduce mobility. Muscle weakness contributes to fatigue, weakness, and reduced activity tolerance. Joint problems are extremely common, and this may be anything from mild stiffness to debilitating arthritis. The risk of injury increases because gait changes, instability, and loss of balance may lead to falls. Some elderly people have reduced reflexes. This is most often caused by changes in the muscles and tendons rather than changes in the nerves. Involuntary movements like muscle tremors or fine movements are more common in the elderly. Inactive or immobile elderly people may experience weakness or abnormal sensations. Muscle contractures may occur in people who are unable to move on their own or have their muscles stretched through exercise. So how do you prevent osteoporosis? There are things you should do at any age to prevent weakened bones. Eating foods that are rich in calcium and vitamin D are important. So is including regular weight-bearing exercise in your lifestyle. Those are the best ways to keep your bones strong and healthy. Getting enough calcium all throughout your life helps to build and keep strong bones. People over age 50 need about 1,200 milligrams of calcium every day. Foods that are high in calcium are the best source. For example, eat low-fat dairy foods, canned fish with soft bones such as salmon, and some dark green leafy vegetables. Check the labels on foods like orange juice, breads, and cereals to find those with calcium added. And if you think you aren't getting enough calcium in your diet, check with your doctor first. He or she may tell you to try a calcium supplement. Calcium carbonate and calcium citrate are two common forms. You have to be careful though. Too much calcium can cause problems for some people. On most days, you should not get more than 2,500 milligrams of total calcium. That includes calcium from all sources, food, drinks, and supplements. And make sure you have plenty of vitamin D. Your body uses vitamin D to absorb calcium. Most people's bodies are able to make enough vitamin D if they're out in the sun without sunscreen for 10 or 15 minutes a couple of times a week. You can also get vitamin D from eggs, fatty fish, and cereal, and milk fortified with vitamin D. If you think you're not getting enough vitamin D, check with your doctor. So treating osteoporosis means stopping the bone loss and rebuilding the bone to prevent breaks. Diet and exercise can help make your bones stronger, but they may not be enough if you have lost a lot of bone density. There are several medications to think about. Some will slow your bone loss and others can help you rebuild bone. Talk to your doctor to see if one of these might work for you. So what we learned today: aging changes us. A healthy lifestyle with a well-balanced diet and exercise program helps protect our muscles, bones, and joints, and leads to an overall sense of well-being. Get screened to determine the baseline of your bone density and take medicine to help build bone if appropriate. For more information on aging and osteoporosis, visit these trusted websites. And that concludes our presentation. Lovelace wants to make sure that members are knowledgeable about preventative screenings, recommendations for specific chronic illnesses, and general prevention activities. Please take a moment to review this slide. And this next slide continues with more chronic conditions and recommendations if you have these diagnoses. If you have questions about any of this information, please feel free to email us at healthysteps@lovelace.com. Here are some complimentary resources offered to Lovelace Health Plan members. We offer telephone counseling for weight management and smoking cessation, online health tools, including a health risk assessment in your health center, and also we offer wellness discounts and monthly webinars about different health topics. Go to our website at lovelacehealthplan.com, click on online member options, and follow the login instructions to access these resources. Thank you so much for joining us today. Again, if you have any questions about our webinar, please email them to us at healthysteps@lovelace.com. Remember to complete the evaluation you will receive via email. We do value your feedback and use this information to improve our efforts to support you. And remember, check our website regularly and register for upcoming webinars. Again, thanks and have a great day.